Today we are doing Agnes, which is microneedling with radio frequency to help get rid of some excess tissue. So we're going to be doing a submentum, otherwise known as a double chin, but you can treat anywhere. We often do Agnes for jowls, we treat fat pads under the eyes, you can treat lipomas. If you've had any kind of surgery for liposuction and you have like a little area of fat that's still left behind, we can use Agnes to help get rid of that fat forever. It is permanent. So I've already numbed our patient and we're going to just go underneath her chin and we're going to start right down here. You can hear the sweet sound of success. And it's nice because Agnes can be very specific as to where you want to do it. As opposed to just putting an applicator on where there may be fat, where there is fat. So this is very, very customizable. And oftentimes people do have some genetic predisposition to tissue under their chin. Doesn't mean we can't get rid of it. Are you hurting?
No.
Perfect. The area here is all blanched because I used the lidocaine beforehand. Oh, those are good. You can hear it and it sounds great. And we always recommend 2 Agnes, so 1 now and 1 again in about 4 to 6 months. And then we always combine Agnes with Scarlet. So Agnes kills the fat and then Scarlet comes in and lifts and tightens the tissue. So they work very well together. Sometimes people use some Pronox or laughing gas to help if there's discomfort. I'm gonna go down a little bit lower because we have a little tissue down here too. You okay here?
Mm-hmm.
Yep. So what's great about Agnes is that you get the needles into the skin and then the radio frequency is delivered that kills the fat. So it's different than the radio frequency that you just do on the surface because we're delivering it to where it needs to go to. So it's much more effective. Other options for treating here would be doing something like Kybella or cool sculpting, but sometimes it just depends on the fat distribution as to if those are going to be an effective option. So we're going to go ahead and repeat all that, but in a different direction now. Let's go. You doing okay?
Mm-hmm.
So now we're going to do tacking, where we're pulling our patient's skin back to help the results in the front. Sometimes people just do this for their, I mean, not if they have any fat, but they just do this for laxity of their skin. That is Agnes lift. So there's lots of things we can do with Agnes. Downtime would be maybe some bruising, and actually, when you combine it with Scarlet, the radiofrequency from Scarlet helps the bruising from Agnes because the radiofrequency helps coagulate. So the two together work really, really well. If you want to find out if Agnes or Scarlet or both are right for you, you can find us online at RejuvenationMD.medspa.com.